Hello, everyone. Thank you so much for joining us on this lovely afternoon. And my name is Susan Ward. I'm with the Bureau of Student Wellness with the New Hampshire Department of Education. And as we're heading into the darker months and as anxiety and stress are on the rise, we'll be covering some different wellness topics during the next few weeks. And on Monday, I briefly introduced the topic of seasonal affective disorder. And today we are going to be talking with Jodie Lubarsky from Seacoast Mental Health. And Jodie, I just want to thank you so much for joining me today. I really appreciate your time.
Thank you, Susan. I'm really glad to be here today. And I was excited when you outreached me, not excited necessarily that we're talking about seasonal affective disorder and the impact that has on all of us, but also kind of just having that opportunity, I think, to be reflective of the pandemic and maybe talk a little bit about resources, what's available here in the state of New Hampshire, how to support our educators, our families, the students and children that we're all working with day to day. So thank you for having me today.
Yes, yeah, you're welcome. No, I think it's such an important topic and feels like it's the right time to start having the conversation.
Well, and if it's okay, you know, and we talked about this beforehand, this is a new process for me, but I was thinking that it might just be really important. One of the things that I think it's good for us to reflect upon is just the pandemic itself and the impact it's had on all of us. And, you know, when I was sitting here today reflecting on our conversation this afternoon, thinking about in March, when a lot of us were told, you know, you're gonna be working remotely, your children are coming home to be educated remotely. And I think on that day, when I think about the day here in the center and when we were making those decisions, we all thought it was gonna be 2 weeks. We're gonna send everybody home for 2 weeks. We're doing this very quick pivot. You know, here at the Mental Health Center, we did a very quick pivot to figure out how our staff are going to work remotely, providing telehealth to the families, the adults, and the youth that we work with. And again, I think many of us thought, like, all right, 2 weeks, and we're going to be right back at it again. And here we are, almost 6-7 months into this. And we're heading into this as we head into the holidays, as we head into a period of time here in New Hampshire and New England where we start to see our days getting much, much shorter. Probably for a lot of us, it crept up on us that this weekend is not only Halloween, but we're setting back our clocks and recognizing that we were already noticing those days getting a little bit shorter, but you know, we will definitely notice it as we're all heading out, whether it's shutting our laptops down at home when our workday ends, whether it's leaving the office, leaving our school building, and starting to see how much darker it is. So we're talking about how we're going to get through those cold, long winter months here in New Hampshire while we're still battling this challenge of a pandemic that at times still doesn't feel like it's under control. You know, and I think when we start to have this conversation around seasonal affective disorder, it's hard not to really still correlate that with the pandemic as we're starting to see some increase in numbers across New Hampshire. We're all very aware of the reports where we're seeing, you know, cluster cases, whether it's at a community establishment, a gathering that happened. And so we're going into winter at a time where it's important for us to remain really connected to others. You know, when we start to think about seasonal affective disorder, excuse me, and how that can impact someone, when we think about strategies are really around remaining socially connected, being with others, how we lift ourselves. And then that's contrary to when we think about the pandemic and what we need to be doing right now to socially distance ourselves and keep ourselves healthy and safe and our family members healthy and safe. So it's a really tough time as we go into these next few months.
Yeah, absolutely. And I think I have an echo. Sorry about that. That's one of the things that I started thinking about too, as far as thinking about seasonal affective disorder. It's a time where we might be isolated anyway because our days are shorter. It's difficult to do activities outside the way we may have done for the past few months. And I started to try to use the term physically distant because the social piece is just so important, and keeping connections and keeping those relationships and even building on them and making sure that we have them in our lives, because relationships are so important to our social well-being. We're social animals. So just having that connection to other people is just really important.
Well, and I think you're absolutely right. You know, regardless of whether or not you're an introvert or an extrovert, we hear those labels all the time. Regardless, you still want to be connected to others. It's really how we fill our buckets, whether it's with our immediate family members. If you're an introvert, it's having that small, close network of people that you can trust or rely upon. I think as we went into the pandemic, we really got concerned about those who maybe are more extroverted social butterflies, the thrivers, sometimes we call them, especially when we start to think of our students, because we were taking them away from those environments where they really shine the most. They needed to feel the pulse of their school hallways. They needed to be in that classroom setting surrounded by their peers. And then when you start to think about educators, they got into this work because that's also something they enjoy. They thrive off of that. They want to see their students succeed. They want to promote them. They want to be that mentor, that leader in their life, where sometimes students don't have that outside those school walls. And so when I think about, again, when we start to talk about the seasonal effect that life in New England is going to have on a lot of us anyhow, and this pandemic that kind of threw us into this unexpected grieving period. Because, when we think about grief, I think we really have to look at it through the lens of changing our life as we once knew it. On that day in March, when we all got sent home, our life changed forever as we knew it. For you and I as adults, we probably had been through something in the past where we had to manage a difficult time or period in our lives and some change. And maybe we did go through those stages of grief as a result of that change. But when I think about our students, when I think about younger adults, that this might be the first major traumatic event, major change event in their life, and not necessarily having the tools and strategies to get through it. So we changed life as we once knew it. Probably the easiest example to use is maybe a household, and we think about a typical kind of structured household, 2 parents, maybe 2 kids. And in March, we threw them all home, and now we have students, children who are learning from home. We have parents who are being educators from home, being caregivers, being spouses or partners to each other, being employees. And you're mixing all these roles together, and no longer do they get a break. When 3 o'clock, 5 o'clock came, they took their laptop, they put the lid down, and they switched roles into, becoming caregivers again. And I say that because now let's put grief into this, changing life as we once knew it. And you may have one parent who's just angry by everything that's happened. They can't believe all these changes have happened. Their life has been turned upside down. You have another parent maybe who's in denial, like, this will be 2 weeks. There will be a vaccine. The virus will go away and we'll be fine. And I'm going to just stay in that place. And then you have children who are just absolutely confused. And unfortunately, the trends that we're starting to see now, becoming more and more sad, lonely, feeling isolated and anxious by what's happened. And so when you have a household system where everybody's in a different stage of grief, it wasn't linear where we said, today you're all in that anger stage, and that's going to last about 2 weeks. And then the whole family gets to move on to sadness. Everybody, it's like the spider web where everybody's getting tangled up with each other. So we're still trying to resolve this change of life as we all once knew it back in March. And now we head into a period of time where we may not be able to connect with relatives the way that we used to during Thanksgiving or the winter break holiday. We may not be able to spend time with loved ones the way we have. We may have families and we may have people who are with us today who have had economic losses and changes because of the pandemic, which means going into the holidays might be even more challenging and difficult for them. And like you were just saying, Susan, we can't necessarily engage in the same activities that we once did. So we know that skiing is a big industry here in New Hampshire. Not everybody skis, but we know it's a big, not only tourism component of our state, but also a lot of us engage in that activity, and skiing's not going to look the same. Outdoor ice skating, we're already seeing the changes with hockey, which is a big sport here in New Hampshire and New England. And so we want to talk about strategies and what everybody can do to take care of themselves and remain connected and remain healthy. And yet at the same time, there's so many parameters in place that it almost creates more sadness, more apathy, more just lack of that kind of will to want to keep pushing forward and get through it when it's become so difficult and so challenging during this time.
You're so right about those challenges. One of the things you mentioned a few minutes ago, and I'm sorry if there's an echo, you mentioned grief, and it was really interesting when this pandemic happened, and I'll be vulnerable for a minute. I experienced grief. I couldn't name it, which was really weird. Just having a mental health background, I was experiencing all kinds of emotions, and I said, man, this really feels like grief. But what did I lose? I didn't lose anyone. I didn't have any huge significant loss. Why am I having like grief feelings. And then I realized it was ambiguous grief of what I may have, my routines that I may have lost, or my,
Right.
my normalcy. And then I started thinking, wow, if I can't put this to words, if I can't put words to this, or meaning, or it took me so long to do that, how is that in the mind of a child or an adolescent? How are they processing this? And what does that mean to them?
Mhm.
And so I found it very interesting. And then going through the process, and once I could kind of process it and understand it, I thought, wow, that was a challenge. And what does that mean for people who can't name that? So
Right. Well, and I really appreciate your willingness to be vulnerable. I think we all have to be better about that, because none of us live in a vacuum. We have all absolutely had a moment or more of grief during this period of time. I would agree with you, and I'm going to be that vulnerable person as well, because I think in order to not only remove the stigma when it comes to mental health needs anyhow, but just being able to be human and being able to say, like, this is challenging. None of us are superheroes. There's no way that any of us during the last 6 to 7 months haven't had that moment of weakness, vulnerability, despair. We're lucky enough if we have it and our partner in our life or a friend in our life is not in that same place, because then they get to lift us when we've been lifting them all along. And I remember having one of those moments. And I haven't meant to sound like a broken record, but when this started, I immediately went to a place of talking about grief, recognizing and probably being reflective for my own child. This is the first time she's ever been through a major life event like this. And we always talk about strategies and how we take care of ourselves in our house. But again, as an adult, I had lost family members. I've had transitions, whether it's moving, life changes. And I figured out how to get through those. But for her and other children, as you just said, how do they put words to that? How do they label it? And so I think we all have to be better about being vulnerable. And I reflect upon the fact that she has an incredible teacher. We're so lucky that she gets to be with that teacher again this year. Her name is Kim Lodge. And if she happened to be listening today, there's not enough words to express what an amazing educator she is. And I remember during the remote learning period being so grateful that she was willing to be vulnerable and talking with her students and saying to them, like, how are you all doing? And just checking in with them and saying to them, I miss you. And I feel sad that I can't be with you today. And I think we have to be better about just putting very basic language to that experience we're having as adults, so our kids or the students or the children in our lives feel comfortable enough to be able to say, I feel sad today. I miss life as I once knew it. I wish that I could be playing hockey with my friends right now. I wish I could be going to my Girl Scout, den meetings and sitting with the other Girl Scouts, whatever that activity is, because that's the change they're all experiencing that they don't know how to put words to yet.
That is such a great point. Just having that honest conversation. And I remember at the start too, my son would get videos from his teachers, and they were being very vulnerable and standing in their empty classroom and looking around saying, it's not the same without you. And I'm like, I can't watch this. I'm going to cry, because it was, being a former teacher as well. I loved being with my kids. I loved being with my students. Exactly why I got into teaching. And so to see their vulnerability and just communicate that feeling like, I really miss you, is just so important. And really just kind of opens up that conversation too about, here's what I'm feeling and it's okay.
Right. And when you say that, I think about I've never been an educator myself, but I know just like the teachers here on the mental health side, we all made that quick pivot. I was never taught in graduate school how to provide therapy over a screen. So when I was told, go home, I had to learn and figure out, like, how am I going to do this genuinely and authentically with supervisions, with clinical appointments? And yes, we've all figured it out, but I recognize and have so much respect for educators, because I'm sure all programs have changed now. There's probably like televideo, telehealth 101 in every academic program at university levels now. But you, the educators and all of you listening today, you had to make that really quick pivot as well. And none of you went into this work thinking, I'm going to be sitting in an empty classroom with no students around me, not feeling that energy, not thriving off of it, and sitting potentially in my home, in my kitchen, watching the screen, and also having to potentially educate my own children or keep them on task at the same time. And so, one of the things that we were having a brief conversation about that I'm so worried about is I really see teachers as these altruistic people who put the needs of everybody else first. They're always worrying about filling the buckets of their students and meeting the needs of their students. And during this pandemic, as they make those pivots back and forth to in-person, remote, or hybrid learning environments, worrying about these students, looking at them that they haven't seen in months to make sure their both academic and social needs are being met, I worry that so many of our educators aren't filling their own buckets, and that it's going to catch up really quickly to, not recognizing that they needed to take care of their needs. Like you and I were just talking about a little bit ago, how do they connect? How do they take care of themselves outside of their work? And how do we make sure we're all being vulnerable and putting labels to it that this is really hard? This is not easy. Whether you're an educator, a mental health provider, a parent, a partner, whatever your role is in life, when we all wear many hats, this is just not an easy time for anybody. And I think we need to be comfortable talking about that.
Absolutely. You make such a great point, because in just talking with a few educators, one of them expressed to me, we're in school sometimes during a hybrid time, but because we have to be physically distanced, because we have to be in our classrooms, we're not having the water cooler conversations. We're not in the teacher's room saying, oh, how'd it go today? How was your meeting? Or, and just bouncing those conversations off each other. And she's like, I am here with all of my colleagues and I'm completely isolated. And
Right.
so, not even being able to connect with your colleagues and they're right there. I feel for them.
Yeah.
and think about what that must be like. Just not even being able to have those easy conversations that people used to have that maybe got them through their day too.
I was just thinking that because, we're going to call them those water cooler conversations, those brief moments. I always view those as decompression moments. Those are those opportunities, even here at the mental health center, we're equally as distanced and isolated in the work that we're doing. And it used to be I'd open my door and I could go out there and find somebody, and you start that 2 or 3 minute conversation. And it's enough to just kind of take your mind off what you were doing, what maybe was kind of stressing you out a little bit, and just having that moment of levity. And we're at 50% capacity in our buildings. When we're in our building, a lot of us are remaining in our offices and not as connected as we once were. And I can't imagine what it feels like to lose that decompression time. Whether it's your commute into work, your commute home to work, those water cooler moments, those are those moments we need. It's our reminder to take that deep breath, that reminder of how do we practice a little bit of self-care. And sometimes self-care is a 5-minute conversation with a friend or a colleague. And that's a big component of our professional lives that are missing right now.
Yeah, absolutely. And I start thinking about how this has really forced people to be creative in connecting and figuring out, okay, I need those relationships in my life, whether it be with family, friends, colleagues, and looking at how they're creatively kind of coming over that hurdle. Like, is it, game night on Zoom? Is it,
Right.
Just, hey, let's just have a conversation over the phone because we might be zoomed out because we've been Zooming all day.
Yeah.
How do we even have that conversation on the phone? Or, how can I just take a few minutes here and there and de-stress and then just say, I'm going to call so-and-so and maybe have the kind of conversations we used to have.
Right.
So I see a lot of creativity in that, which I think is going to be really important in getting people through these next dark, challenging months.
I would agree. And especially not only the long, dark, challenging months. And, maybe the moment of hope we have to offer is as soon as we set back our clocks, don't forget that on December 20th, we'll start to gain time back again too.
Yes.
So every little minute helps. But when we start to think about that, I think again, too, it's how do we do this and how do we do it when some of our traditions have been taken from us? When I think about, again, what the pandemic has done as we lead into the winter months, and when we think about Thanksgiving, the winter holiday, whether you celebrate Christmas or another, form of celebration during the month of December, our traditions are going to be taken from us. Our gatherings, everybody, I've been also talking about like how we've managed the pandemic is almost on a continuum. And one thing that I think we have to speak about today is we can't judge others for the choices that they make, because the choices that everybody is making are the best ones for them. And whether you have made a choice to kind of continue life as you've always known it, or you are following CDC guidelines to a T and you could be their poster child, we have to respect every step that every person takes, because it is unique for them and is individualized for their family system. And none of us should have to wear labels that say, I'm immunocompromised, I'm anxious, I'm scared, I don't believe it. Whatever the case may be, we just have to respect everybody's choice and the value that they put behind this. At the same time, we know it's going to change those rituals, those gatherings, those happenings that many of us are accustomed to. And so how do you go into the winter months knowing that, and what do you do, like you said, to plan for or have something in replacement of that? If it once was that your family got together on Christmas Eve, how do you have that Zoom get together instead? How do you maybe what families do is they decide, okay, so we can get together, but we're going to plan a family cocktail for Christmas Eve. And so everybody's going to make sure they get apple cider, cinnamon sticks, clove. We're all going to make hot cider. And at this time, we're going to have our cup of hot cider, come together. And it's still figuring out what that tradition is this year in replace of being in person with each other. And when we start to think about the winter months and what do we need to do, what are those strategies, how do we take care of ourselves, it's finding those ways to remain connected, even if it's at a distance. How do we still remain connected? Because that connectedness is going to be key. How do we create those structures, those routines, those special moments? Because this will become part of our core memory. And so what do we want to look back on a year from now, 10 years from now, when we think about the holiday season 2020 and how we celebrated that?
That is such a great way to look at it, and really framing the way of thinking as, this is a challenging time. How can I make it positive? How can I still be connected? And how can I still build those memorable traditions that are going to look different than what I know?
Right.
So,
because I would be remiss if I didn't talk about the fact that as a child and family therapist, we have to be mindful of how we role model for the children in our lives. Again, whether you're a parent, a caregiver, an aunt, an uncle, an educator, we set the tone for how our children adapt to this. So if I go into complete shutdown mode, if I don't let my child have any kind of form of celebration, if I don't figure out a way to create routines and structure in a healthy manner for her, I'm sending this message, without really considering it, that she needs to be worried, she needs to be panicked. And I'm not sure how that's going to build character for her when we come out of this. It's figuring out, how do we have an open, honest conversation that this is what we're experiencing right now. The one thing we've said often in our house is it's not going to be forever. There have been other moments like this in our history, and they've come out of it. We've come out of it as people, whether it's the Spanish flu, whether it was the events that happened on September 11th. We have had these pivotal moments in our lives as Americans, as human beings, and we figure out a way to get through it because we are resilient. But I have to be aware of what's that messaging. If I'm doom and gloom, if I'm sad, if I send this message of hopelessness, I'm sending this message to my family that they need to be hopeless as well. And I don't want them to be. It is hard, it's difficult, and we're all entitled to have a bad day, but we have to have hope, because without hope, we can't move forward.
absolutely. And I love how you hit on resiliency. And resiliency is so important in getting us through, and knowing this isn't going to last forever. What strategies can I use, and what can I put in place to be sure I can get through this winter pandemic in a winter in New England? What strategies can I put in place so that, you're right, I'm being a great role model. At the same time, I'm doing it for myself as well.
Absolutely.
And making sure that I'm surviving and thriving at the same time.
Right. And strategies don't have to be professional care. We're both recognizing that we both have a background in mental health. We have mental health degrees. And so you and I can both easily wear that hat. But but strategies don't have to be professional care. I don't want to negate the importance of professional care, and we need to be really mindful as parents, as human beings, as caretakers, as educators. We're going to know when something's not going well for a student or a child in our life. And parents will be the ones to best recognize that. They know their children best. Beyond that, educators or pediatricians are probably the other individuals in a child's life who spend the most time with them, who can see distinct differences. And so we want to be aware of when a person is going from a place of well to unwell, and beyond just typical strategies that they can implement, where we really need to start recommending and seeking out professional care. Prior to that, though, we have to be so focused, I think, on structure and routine. Structure and routine is so important. When I think about, just from the place, and kids will kind of balk at the idea of structure. They don't want rules. They don't want to be told what to do. But we know that structure and routine creates a sense of safety. It creates a sense of consistency in children's lives. And so in this world right now that seems very chaotic and out of control, when we can implement structure and routine in the house that's both loving and caring, I think we've now been able to take the outside world that feels very chaotic, and within their home environment or their school environment, create safety and stability for them. We can think about exercises, getting outdoors, whether it's brisk walking, whether it's taking on a new activity, whether it's family bike rides, running together, building forts outside. Everybody's probably got too many leaves, pine cones, and sticks in their yards right now, and they've got to get them cleaned up before the snow comes. So go outside and build a fort together. Create a project out of all of those leaves. Figure out ways to be creative with each other outdoors. It's making sure we're taking care of ourselves, that we're practicing self-care, that even when we're working from home, that we're getting ready for work, that we're showering, we're grooming, we're dressing, we're presentable, and making sure that even if we're on telehealth all day or on video all day, that we're presenting ourselves the same way as we would have if we had walked into an office building, into a classroom. That goes for both the students and the educators as well. It's doing things like journaling, it's connecting to friends, it's phone calls, it's, if you're so Zoom exhausted at this point, it is just picking up the phone and talking instead, or saying to a friend, I know we can't hug, but we can be 6 feet apart. Can you get a cup of coffee and I'll get a cup of coffee and let's just go take a walk together. It's that staying connected piece that's going to lead to that open and honest communication. It's going to lead to that opportunity, like you and I both did, to be vulnerable and say to each other, I'm scared. It feels like this is never going to end, and I'm not sure how I'm going to get through it. But we have to take those opportunities to lift each other, to practice those strategies. And when those things don't work, recognizing it's time for me to probably find somebody that I need to be able to spend some time with and talk to, who can be objective, who's not part of my daily routine, and can give me more strategies to tap into.
Absolutely. I know it's really important to have those support systems and have those connections, and knowing, okay, I'm really struggling and this isn't really working. My next step is to reach out and get some professional help.
Absolutely. So, and that can be a hard, I think, place to be aware of. I'm sorry, I didn't mean to interrupt you, but I want to make sure that I think from both the adult perspective ourselves, for those of us who are working with a child, in the lives of a child, a youth, an adolescent, what are those warning signs? What are those kind of non-negotiables that you don't pass go, you go straight to professional care? And it's really when we start to see those increased signs of depression or anxiety, the sadness that just doesn't lift, the changes in appetite and sleep that are so extreme, whether it's sleeping too much, whether it's not sleeping enough, appetite changes, significant weight loss. Things like self-harm, expression of wanting to harm oneself, direct comments about suicide, having a plan for suicide. Those are those non-negotiables that we want to make sure that we're either getting ourselves or that person in our life, that student, into professional care, getting professional assessment to make sure that we're maintaining the safety of the individual. And one of the things that we're very fortunate for in New Hampshire is we have so many resources, and we're focusing on educators today. I've always viewed the school and the education setting as being one of those beginning places. Teachers may identify that student first who's not doing well. They may identify that colleague who they know to be generally jovial in nature, and they're seeing that colleague pull away more and more all the time. It's accessing social workers, guidance within the school building. As professionals, it's making sure we're taking advantage of our employee assistance programs utilizing the mental health benefit on our health insurance, and really getting somebody and helping bridge that warm handoff to care if that professional care is needed, either within the community mental health system here in New Hampshire amongst the 10 organizations. We have a robust community of private providers across our state. We have 24-hour, 7-day-a-week emergency service care from those community mental health centers. So I want our listeners today to know that there are resources available, and it really is just one click of the internet or a phone call from any of those options that are out there.
That's great to know. And one of the things that I saw that might be useful, and I would love to hear your thoughts about this, is a safety plan. So just a safety plan that says, and I know I've seen many different types, but maybe something that starts off with, I can tell I'm struggling when I feel, or when I have this, and this. The people I can connect to when I'm feeling this way are this person with their phone numbers. And then strategies I can use, this, and this, whatever, and have that person write whatever works. And then having those crisis numbers at the bottom so that somebody doesn't have to search for them, but they're right there, and having the safety plan, and people could call it whatever they'd like that makes sense to them, but having it somewhere where they're going to be able to access it easily and quickly, and they know exactly where it is at all times.
Yeah, no, I think that's fantastic. And you hit upon all the key areas that we want to make sure at the mental health center, when we're thinking about mental health care, that are on a typical safety plan that we would do with a youth or an adult who's struggling. It's what are those signs and symptoms that I know I'm struggling? What is it that others around me would start to recognize and notice that I might be struggling? Who are, like you said, Susan, who are the people that I can reach out to? What are those things that I can do that help lift me, who maybe take me out of that place? Another thing that and then I love the idea too of having the resources, because you're not scrambling to figure out who I call, because you can just pick up that piece of paper and they're right there. Another thing that I like to add is, what are the things that don't work? So when I think about our work with adolescents, they may say, like, it doesn't work for me to talk to my mom, or it doesn't work if my coach approaches me about this. So I think having that sense too of what are the strategies that don't work. Don't tell me to journal. Don't tell me to do yoga, because I don't like to do yoga anyhow. I'm not a patient person for it. Making sure we put those things on there, because people are very well intentioned, and what may work for me will not work for you. And so we want to make sure we're trying to target those things and put those things down that would really help a person. I love the idea of a safety plan, especially if we know that a youth or an adult in our life is already, prone to struggling. If this is somebody we know who's already struggled with some depression or anxiety, the pandemic has kind of set them back a little bit, and going into these moments, these isolated months, the colder months of winter might be a trigger. I think it's really important to have a good plan in place.
That's great. That's such great advice. And I love the part where you say putting what doesn't work, especially if there's a parent also looking at that safety plan with that adolescent child, whoever it might be, and going, oh, I will make sure I don't mention journaling, because that's something that he or she is or they have indicated that it doesn't work. So.
And a real tricky strategy, because some people will say, like, I just need some time for myself. I need to be able, and I hear this a lot from teens, I need to be able to go to my room and have some time by myself. And then parents or caregivers, on the other hand, will be really worried, like, but they're not supposed to be alone. If they're sad, they're depressed, I'm not supposed to leave them by themselves. And so you kind of define that parameter, like how long. I'm not going to let Susan be in her room by herself for 48 hours, because that's far too much time to be isolated from others. But if there's a moment and she says to me, Jodie, I just need a break right now. I just need to go to my room, have some time to decompress. Maybe that's an hour. Maybe Susan knows that periodically I'm going to knock on the door and just say, I'm not coming in, just want to check and make sure you're okay. So you set some parameters around if somebody needs that one-to-one time. At the same time, making sure we're monitoring them for safety, monitoring to make sure that their needs haven't been compensated in any way.
That's excellent.
Because we all need some alone time sometimes. Like, we just need that moment to decompress. We don't necessarily want somebody in our face saying, like, let's go journal, let's take a walk, and then let's go do some mindfulness afterwards. Those are great activities, and journaling and walking and mindfulness, being with others, talking are absolutely amazing strategies. Recognizing, though, that sometimes as human beings, we just need a little self-time to process it. to maybe decompress ourselves before we can reach out and say, I'm ready to go take that walk, or I'm going to go grab my journal right now and kind of write down what's going on for me. So there's a good balance between having some alone time, just not too much alone time.
Absolutely. Are there any other things that you'd like to tell educators about seasonal affective disorders for themselves or for their students? Things that they want to look out for, or any other strategies that we didn't already talk about?
Well, and you and I went right into it, and I thought maybe some folks don't even know what seasonal affective disorder is. So probably just important to maybe highlight that a little bit. So generally speaking, seasonal affective disorder is defined as depression related to those seasonal changes as we enter those fall and winter months. And unfortunately, we live in a prime area of our country where people might be more prone to seasonal affective disorder. So really, when we think about fall, early winter to early spring, that's where we might start to see individuals experiencing decreased energy. We start to see some fluctuations in mood, either feeling more sad, agitated, maybe to get angry easier. They're starting to withdraw, isolate. They're losing interest in activities that they once enjoyed. Again, very similar to depression. We see a lot of overlap between those symptoms of depression and what seasonal affective disorder looks like. Changes in sleep, appetite, just feeling a little bit more sluggish, hopeless, having suicidal thoughts potentially. Doesn't mean you're going to, but that's a potential risk. And again, that's one of those non-negotiables that we really want to be aware of. But just being those like kind of winter blues, like just you think about it of the doldrums of winter. And I think really it probably hits people more when we get out of the holiday season. I think the holidays tend to keep a lot of us very busy and active. There's things to look forward to. And when we cross the line over to the new calendar year, New Year's Day happens, I think that's when we start to see where it feels like winter just goes on forever. And especially in New Hampshire, it can go on forever sometimes. Sometimes it goes until April and we get that, April Fool's Day snow that we weren't expecting. So that's typically what we're thinking about with seasonal affective disorder. It does have a lot of correlation or overlap between depression. And we would really address it in some of the same manner. If somebody's really struggling, they find themselves seasonally in this pattern, we might recommend that they seek therapy. In addition, some medication management in combination with therapy would be potentially beneficial. In some cases, people use light therapy, so they'll get like a lamp that they'll spend some time with in order to give themselves some light therapy to get some of those, that vitamin D and work on the endorphins and the serotonin pickup. Exercise, being connected to others again. But when we know that somebody has a history of depression, maybe even a family history, that this has been kind of a pattern for them during those cold winter months, they might be at higher risk for seasonal affective disorder or being impacted by those seasonal months. So it's being aware of it in ourselves. I mean, do we all get a little bit of the winter blues? Absolutely. It's hard in New England, especially when we get into some of those cold stretches. It's whether or not you can get out of that. I think that's the difference and what to be, really aware of as we go into these longer, colder months.
That's great information. Absolutely. I know February can feel like it's about 3 months long for sure.
Yes.
Then
it's the shortest and longest month of the year.
That's so true. And then in the spring, when we see grass, it's like, oh, we're in a colored movie all of a sudden. So yes, I can relate and have the happy lamp. So it is helpful.
And I think for folks to just be aware that, again, there's so much opportunity for care out there. When I think about the relationship that many of us may have with our primary care physician, for children, it might be that relationship with their pediatrician. That might be a really good starting place to discuss and explore treatment options, especially if somebody's having the winter blues, experiencing some seasonal affective effects of the winter months. But I think if there's more long-term depression, anxiety, other mental health challenges for an individual, beginning with primary and medical care, they may have good resources, they may have good ideas as far as, because they've treated us for so long. My PCP has good insight into who I am, and so may have suggestions on who might be better fit for me. But also for children, again, the school personnel, they have such a wealth of resources between guidance and teachers and social workers and school psychologists that, again, not only might be able to provide some brief care, but also some great options as far as care that might be a good match for a child. looking to our faith community, anybody who is very spiritually connected to a house of faith or spirituality, that might be a great place to seek care. Looking at our community mental health system here in New Hampshire, NAMI, New Hampshire, private providers, peer support specialists. I mean, we're fortunate that there's a lot out there. And so there's a full menu of treatment options, that there's not necessarily a one size fits all, and people should be aware of the different resources that are out there for them.
Absolutely. Thank you. And thank you so much for taking the time today to talk about this really important subject. And people who are listening, if you have any questions, please reach out on the chat. I can definitely check it and have you make sure I provide you with an answer, and hopefully put you in touch with any resources if you need them. I'll make sure you receive that. So I just want to thank everybody also for tuning in today. I know it's a very busy week, and we're all super busy, but if you were able to watch this today live, or even when this is at a later time, because this is recorded, we really appreciate you taking the time to listen and tune in. So
thank you so much for having me today, Susan.
Yeah, thank you so much, Jodie. This was really helpful, and I really appreciate your time.
All right, take care, everyone.
Bye, everyone.